So imaging is always present in meeting because it's very important in multiple myeloma. So we have some acquired points. For sure, we are using novel imaging techniques, widespread use of this, both for staging and also for disease evaluation after therapy. We can say that we have clear guidelines now how to use imaging modalities, how to interpret these imaging modalities. Several studies are still ongoing comparing PET-CT and DY-MRI as regards to sensibility and capability to capture the disease. So this is currently ongoing. A lot of other trials are currently using functional imaging modalities to evaluate response after therapy. So currently the standard of care is PET-CT, but there is an increasing role in diffusion-weighted MRI, and very recently it was demonstrated the role not only of a single evaluation, but also of the so-called sustained imaging MRD negativity after therapy. So, for example, one Italian group showed that DY-MRI negativity after 1 year from the end of the treatment phase, it is very important for the prognosis of the patient, so maybe it will become a goal in our follow-up of the patients. We have new tracers for PET, alternative to FDG, in those cases where patients are falsely negative because they are not able to trap the FDG in the cell, as well as, of course, we can use diffusion-weighted MRI. The open issues that are still there are how to integrate imaging with other minimal residual disease evaluation modalities, so bone marrow and peripheral blood, if it will be something like to alternate these techniques in specific time points, so this is still ongoing. Another important news is that the techniques are all standardized now, so we can rely on standardized criteria both for PET-CT and MRI. So this allows to use all the techniques in different places with the same goals. And also imaging currently is being integrated with other prognostic factors, both genetic and clinical, in this artificial intelligence model. So this is also something very new. And lastly, I would like to mention the fact that within the International Myeloma Working Group, we are building a platform where you can upload imaging scans, and the goal of this is to refine imaging response, in particular in new immune therapies, so CAR-T and bispecific antibodies. So this is something that it is still ongoing.